like worshipped. Remember those years, long time ago. I trained years ago. So nurses were worshipped, were heroes. So every child who grew up in my community wanted to be a nurse. But you know, when you go to school and all the experiences you forget, and then one time you come back, oh, remember your passion from the beginning. And then I
Yeah.
joined nursing. I wanted to be part of those nurses who were held in high esteem in those days.
Wow. Mm.
Mhm.
So, Sister Elizabeth, where did you study?
I studied in 1991, and I
Mm.
studied at a college. The college was within Johannesburg Hospital, which is now called Charlotte Maxeke. There was a
Oh, okay.
nursing college, but it was closed because there were too many colleges when they were
Mm.
restructuring the nursing
Yes, yes.
colleges. Yes.
Oh, okay. And can you tell us more about your experience as a student nurse in those days? I know my grandmother, she trained a long time ago, and she always tells me about her experience as a student nurse, and it's so different from our experience as young ones, as student nurses. So can you please tell the viewers about your experience as a student nurse?
In those days, as student nurse, we wore white, a white
Mm.
crumpled dress with stockings
Yes.
and set shoes. And then you will go to, like, when you come to the ward, you know your place. You know you'll go to the sluice room, you clean it.
Mm.
It's your pride and joy. You clean it, you
Mm.
find the bedpans shining, and you look at it, you say, I've done a great job. Before you even
Wow.
touch a patient, you have to make sure it's pick and span there. And
Mm.
then bathing the patients, at some stage you were cutting patients' nails, and it was like, wow,
Wow.
wow. We wash on weekends, we would wash patients' hair and cut their nails and groom them so that when the relatives come, they see that this one is well taken care of. And we were so happy doing that because we didn't see anything wrong with it. It was
Mm.
caring for the patient from beginning to the end.
Wow. Wow. Um, I've seen this being done as a student, but not every weekend. And I'm jealous. I actually wish I had trained in your time. So, Sister Mkhondo, you're a registered nurse and your specialty is primary healthcare. And
Yeah.
presently, you work with patients who've been diagnosed with drug-resistant TB. The South African National Department of Health has recommended decentralization of drug-resistant TB treatment service to outpatient settings where you work, like at Stanza Bopape. Decentralization required hospitals to down refer after treatment initiation to lower levels of care settings to facilitate care closer to home. This model has shown improvements in patients' overall care outcomes using physicians to provide care at decentralized centers. Decentralization of drug-resistant TB care from the hospital setting to the primary healthcare setting is a key policy platform of the South African National Department of Health. It is designed to improve timely access to treatment. South Africa is currently using a task sharing model of care for the TB infected individuals. Task sharing follows a shared approach to clinical care where healthcare workers share responsibility on some activities while maintaining pre-existing tasks to share the workload. The task sharing intervention is between a medical officer and a clinical nurse practitioner. Task sharing between clinical nurse practitioners and medical officers means that nurses can take on much of the patient burden, and then the sickest patients are seen by the medical doctors. So nurses in South Africa are at the forefront of the fight against TB. Sister Mkhondo received the Integrity Icon Award in 2018 after having been nominated by one of her colleagues. Her colleague commented that she has a great love for patients, like we've just heard now. She goes as far as using her own resources to go to patients' homes in order to ensure that the patients who are unable to go to the clinic to fetch their medication receive it. This reminded me so much of Florence Nightingale, who worked as a nurse in the Crimean War, making sure that injured soldiers were not dying from wound sepsis. To bring this home to South Africa, this gesture by Sister Mkhondo reminded me of Ma Albertina Sisulu, who was a midwife, and she rendered healthcare to pregnant women in their homes. Just like Sister Mkhondo, Florence Nightingale and Ma Sisulu were known as nurses with integrity. Sister Mkhondo, please tell me about why you feel so passionate about patients that you go to their homes to ensure that they don't default on their TB treatment.
Most of our patients, first of all, they are not working. So coming to the clinic, it's like we like them to come every week, every 2 weeks, and all that is a burden on them already. So the easiest way so that the patient can comply with your treatment and is to go to their home. And in doing that, you are doing a home survey to see what's happening in that house, what's the support system, can you get somebody to support the patient during treatment? And in so doing, you form a rapport with the patient. The patient, they know to trust you and they know where to go when they have problems. And as a result, you avoid them getting lost to follow up. So your patient get well, and they finish their treatment and they regard you as part of the family, of which is lacking lately. The patients tell us anything, but if you are with them all the time, they always tell you their problems. They always appreciate what you're doing. And also you can link them to whatever they need. You can arrange social grants and whatever, because you see that at home it's difficult for the patient.
So kind of like, what do you use to get to the patient's houses? Is there a car that the clinic provides, or do you walk? What do you do?
Usually we use the clinic transport, and then the clinic transport will drop you at the patient's home, and then they wait for you until you are busy with the patient, whatever take you time. Somebody
Yes.
will wait for you, because it usually takes time. You just don't go there and drop the medication and then come back. You have to sit
Yes.
there and talk to the patient, ask them about their experiences, what the tablets are doing to them, and ask them whatever and help them wherever you can.
Wow. Wow. So I love this so much, and I'm glad that this story about you is coming out in public, where there's a wide variety and audience of people who can hear about nurses with passion and love for their job. Because every day in the media we are bombarded with horrible stories of nurses, and there's a few of us every day saying that not all nurses are like that. There are very good nurses out there. So can you please tell us what it means to you? Please share with the viewers the reason integrity is important in your role as a nurse.
Integrity in your role as a nurse is very important, because we're dealing with people's lives, and then
Yes.
integrity should form the core of your care, because
Yeah.
you need to do good regardless of what's happening, regardless of the resources which we do not even have in the public service. You inside of your heart, you must just help the patient, and then not expect anyone to come and pat you on your back. It's for the
Yeah.
patient's health. because your attitude is going to determine the outcome of the patient's care within the public service. So you need to be the one to steer this forward and look after the individual patient. We don't group patients as like there are patients, they are sick. You have to look at the individual needs, at the individual, whatever they need as one patient, not group them and decide to do them. So integrity is very important and it forms part of the core of the care in the healthcare
Yeah.
system.
You know, Sister Elizabeth, as you are talking, I'm reminded of when we were doing the community nursing module as student nurses. And I feel like listening to you, that the lecture slides, and also when we went to the clinic, it's like everything I learned in a textbook, you are doing, you are practicing it. It's not just something you learned and wrote a test and got a qualification for, but you are living what you have learned, and you practice what real nursing is. And I'm reminded of the nursing pledge where we say, I solemnly pledge myself to the service of humanity. And that's what you are doing. You making sure every day that you serve humanity with no excuses and not expecting anything in return. So I want to ask you, what have you gained from building integrity and accountability in the way you work with your patients?
What I've gained within the space where I work is that integrity is infectious.
Yeah,
Because even the team that I'm working with, like they aspire to do what I do, to do it how I do it. Like
wow.
somebody, even if I'm no longer in the service, somebody is gonna take over and move
Yeah.
on and make a better place for the patients that we see on a daily basis. We are public servants, so we serve the public. So
Yes.
we should find a way so that they can have confidence in us again, so that they can know, they can have faith in us.
You know, as you're talking, Sister Elizabeth, I'm thinking of the generational gap in nursing. And your generation thinks differently from my generation. And it's so important for these generations to find a way to work with each other, because I can learn so much from you that a textbook could never teach me. And as I'm listening to you, I'm thinking that the nurses who work with you, the young nurses, newly qualified nurses, are so lucky to work with a mentor like you, who thinks not just for today, but you think for a time when you're not there anymore, and that you want to instill these values in them, so that even if you go on retirement and you're not in the system anymore, but the values that you hold, you know that they live on in the younger generation that you'll be leaving behind. And I think that is such an important thing in nursing, and it's something that really needs to be done more, because even now the International Council of Nursing has done a Nightingale Challenge. And one of the things in that Nightingale Challenge is that they want young nurses to be mentored. And I'm listening to you, and I'm so glad that you are taking mentorship so seriously. I'm very inspired, really, by what you're telling me. So we know that there's still other people right now who are in line to get the Integrity Icon Award. I saw that there's this year there's a social worker, there's a pediatrician from Baragwanath Hospital. I saw that there's also an advocate. So what's your advice to these prospective winners of the Integrity Icon Award?
What I can say to them, that they are already winners, already
Yes.
winners, because they've been doing their work within their sphere and somebody noticed. So as
Yeah.
a group of icons, I think we must soldier on and lead on and call
Yeah.
everybody to come into the space so that we can take our public back because we are public servants.
Yes. And
Mm,
it's so important what you're saying, because we're at a time as a country where people have very little faith in public service and the public system, any system that is of
mm,
state run. People have no faith in it. But when we hear about public servants, such as yourself, who work so diligently, it gives us hope and comfort that things are not so bad. That really there's people who are fighting to make sure that the glorious days where um, uh, people had faith in government can come back. So can you tell us what are some of the challenges you've faced with working in the public healthcare system?
in the public service system, there are many challenges.
Mm,
First of all, there's a shortage of staff
mm,
and lack of resources. And with the advent of COVID this year, it was really
yeah.
hard. It was really hard because at some stage we struggled with PPE, and we were
Mm,
even scared that they were saying that we are ready for COVID-19, and when you're in a facility, you see, man, it's not happening. And we
yeah.
were all so scared. We were all so scared. And also, like the public, you find there's violence, nurses are being beaten, nurses are
Mm,
being thrown at. And it's not like it's our problem because we are not enough. So the waiting times are going to be long, especially in
yeah.
primary health care. Somebody will come in the morning and leave at 4, and it feels like we are not doing anything. But there's lack of resources. I can't just say, come, take this and go. I have to look at you from head to
Mm,
toe and examine and do that. So if I have to wait for one machine in another department, I'm gonna wait. So that
mm,
frustrates the public so that they become angry, they end up fighting us and whatever. And also the morale of staff is it's very low because of what's
mm,
happening. And I think the fear, the another thing was fear of COVID, which made like they were working long hours, burned out, and then they are
mm,
also scared for their families. Nurses are
mm.
also mothers and fathers, so they are
Yeah.
scared for their family, what's gonna happen. And our colleagues also were sick, and many challenges were facing nurses within this year.
Mm.
Mm,
No, I was actually gonna come to the issue of COVID later. But I'm glad that you've actually mentioned COVID. I was actually thinking that this year was the year that we were all excited because the World Health Organization, in partnership with the International Council of Nursing, declared 2020 as the year of the nurse and midwife. And nurses were finally going to be celebrated internationally, nationally, and locally. And we didn't anticipate that our year would be hijacked by COVID and our plans would be brought to a screeching halt because of COVID. And when the world was under lockdown, nurses were out there with other healthcare professionals, nursing people back to health. I remember on the news, they were urging people to continue to add like chronic people to still go to the clinic because people were scared to even come to the clinic because they were scared that they were gonna catch COVID-19. Um, so with COVID-19, did your facility, did you see a decrease in people with drug-resistant TB coming to the hospital to fetch their medication? And how did you ensure that you make sure that they don't default even under the circumstances of COVID-19?
Most of the patients, we see them on a monthly basis, like
Yes.
we give them a date. So
Mm,
we explain to them, those who couldn't come, we usually went to their home to see
mm,
what we can do. But majority of them, they come because they
mm.
know how important it is to take their medication,
Yes,
especially
yes.
with the COVID, because if
Mm,
they get both, they know it's a danger. So they were complying because they know we are family, because that patients are treated for 9 to 20 months. So they end up knowing you, and they
mm.
knowing, wanted to make sure they don't miss a date with you.
Yes. So, Sister Elizabeth, like now you were telling me about like you always say that you are like family to your patients. What do you think has changed with the nurses that we see? Like where have we gone wrong? Why aren't we having that relationship so much with our patients anymore? Why is it that when a nurse goes to the supermarket, they are not made to be first in line anymore because what they are doing is important? What went wrong, and how can we bring back the integrity and the good reputation that nursing once had?
I think what went wrong is their attitudes. I don't
Mm,
know. We changed somehow at some stage, and then no longer respected the patient. But
mm,
there are still nurses who are very compassionate, who put the patient first. First
mm.
of all, patients are mothers, are fathers from where they come, whether
Yeah.
it's a gangster or not, but he's held in high esteem wherever
Mm,
he goes. So we need to like look at them and respect them for who they are.
mm,
Like we talk to them like little children lately, of which
mm.
is not cool. And then also the litigations where some
Yeah.
is just negligence, and you
Mm,
see even yourself that it's obvious negligence, and then I mean, how can they trust us if we do that to them? And
mm,
then the relatives also, they come to the clinic with the patient, and then we just chase them away without
mm,
explaining. It's just want information. When they're staying on the queue is long. Information. Tell them we're
mm,
staying long. We're gonna be so much, so much. We're gonna help you now. Now, when I go
mm,
somewhere, inform them so they learn to respect me. That no, when she goes there, she told us we'll wait for her or whatever. Whatever. So we need to bring back those qualities, those issues back, and have them back to us, because
mm.
the health system is not going anywhere. It's
Yeah.
always gonna be like this. It's not going
Yes.
anywhere. We're still
Yes.
gonna have patients, so we need to have their trust back so that they can trust us with their issues.
Again. Yes. And then, Sister Elizabeth, you've said a mouthful, really. I am so inspired by you. I actually think this interview should be played to all first years who come into nursing when they start their training, because you are such a role model for us. So, in conclusion, I'd like us to focus on young people, maybe young student nurses or high school students who want to study nursing. What career advice would you like to give to aspiring nurses, which they may not receive maybe in school or even in university?
What I can say to them, wherever they go, they must find a mentor. You need
Mm,
somebody who you would emulate or ask. And another thing, people are afraid to ask. You
yeah.
don't know anything. In nursing, we learn every day. You
Mm,
must ask, 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 so that you can know what to do. You are not a magician. You have to ask. And
Yes.
also ask for help. Others, they don't ask for help. They just assume. And you can't do everything all the time.
Yes.
Prioritize your work.
Yeah.
Prioritize your work so that you don't run around. You know what to do and when to
Yeah.
do it. Mm.
Wow. Thank you, Sister Elizabeth. So now we are going to go to the question and answer session. There are quite a few questions for you. There's a question that says you were inspired by the nurses you grew up around, who everyone looked up to. So how are nurses perceived in communities now?
Now we are perceived as not caring, that like we are just there for the money, and that we don't even look after the relatives of the patients when they are in hospital. We just not wanted.
Yeah. But you know what I think, Sister Elizabeth? Like, I think the pandemic has worked in the favor of the nursing profession, because I saw a shift in the attitude of South Africans this year. It looks like there's a respect for the nursing profession has come back because of how they saw nurses fighting COVID-19 and fighting to save their loved ones, their family members, people's lives. And I think even though we didn't get to have the celebration that we wanted for the Year of the Nurse, but the message about the importance of a nurse in a community has come across because of the pandemic and how selfless nurses were in the face of the pandemic. And it's so sad what you said, that sometimes nurses didn't have PPE. Nurses lost their lives caring for infected people. And I think the pandemic has really, I think there's a change that's gonna come for the nursing profession. And I'm grateful for platforms like this as well, where nurses like you come and we can tell people that there are passionate nurses out there. Look at Sister Mkhondo. So I think not all is lost. I'm very optimistic for the future, especially with role models like you, who can hold our hands as young ones and teach us and give us guidance. So, and then, a colleague of yours, Sister Mkhondo, Nomonde Ntlangulela, she says, may I share a few appreciation words on behalf of the TB team under the leadership of Sister Mkhondo. So even your colleagues are here affirming you, and wow, I'm happy for this team that they get to learn from someone with such passion for the nursing profession. Is there a response you would like to give to Nomonde?
To Nomande, I like to say thank you. It's because of you guys that I'm aspiring to be the best for you. And I'm grateful that you didn't take it negatively when we were working together, working out how we're going to help the patients. Thank you so much.
You know what you remind me of, Sister Mkhondo? You remind me of one of my mentors. She likes to talk about ubuntu. I am because you are because I am. And in all your responses around patient care, your selflessness, your passion, you keep affirming that I am because you are. In all your responses, there's that ubuntu that is stamped in everything you say. You see patients as people with families. You see them as individuals, not just a patient, not just a diagnosis, but you see a patient as a whole. and not just what they are presenting with when they come to us. And that's very, very admirable. And then Dr. Verashni Pillay says there's a newfound respect for nurses with COVID. Yes, I agree as well. And then there's also a question that's asking, what support do you think nurses need?
I think we need lots of support from the government. I'm glad that it's Nurses International, 2020 was declared the year of the nurse, because from the policies described there, they're gonna recognize the nurses as the workforce, and they are also encouraging nurses, the governments, to invest in the nursing workforce.
Yes,
So that things
yes.
could get better, and then also encourage us on leadership, so that we can change on the leadership around nurses, and also so that they can do whatever is necessary to see what do nurses need in this age.
Yes,
I'm so
yes.
glad.
I'm so glad you mentioned this. I think you're talking about the State of the World Nursing Report that was released by the World Health Organization. And I'm so glad you mentioned it, because it's a tool that has lots of research that nurses can now use. When we speak to power, we can say, but here's the report coming from the highest health organization in the world. We can use it to plead our case about the things that we need for support. And that's just another thing, Sister Mkhondo. Like, when you are a nurse, just to the viewers, when you are a nurse at Sister Mkhondo's caliber, you need to stay informed with the latest information and listen to how her passion is linked with the latest things that are in the public domain for nurses. So she is an all-rounder. She's looking after patients. She's keeping abreast with the latest research. That is truly, truly amazing. And then what has been the highlight of your career, Sister Mkhondo?
The highlight of my career is the well-being of my patients. You know, we start
Wow.
patients, they come to us after diagnosis, weak, on a wheelchair, unable to walk. But by 9 months, that patient is stronger than even me, and
Yeah.
appreciate and say, "Sister, thank you for healing me." You know, that's the highlight. That's what makes you
Yeah.
glad as a nurse, that you
Yeah.
made a difference in a family, because that person comes from a family.
And the best part about being a nurse.
The best part about me being a nurse is to help people, people who need my help, who need my guidance, who need my understanding. Yeah, that's the best part, because they always come back to us, is this right? Am I doing right? That's the best part.
And it's so true what you're saying. The best nurses I know have patient care at their heart. Like, all of them, really, they echo the words that you are saying, that really, when they see their patients getting better, that is the best part of their work. Now, to go back to COVID-19, Sister Mkhondo, when you were scared and you were looking after all these patients, and you are so scared about what you're scared for yourself as well, because you also have your own family to worry about, and you want to be there for them for many years to come. So how did you deal with the burnout that you were talking about, saying that the nurses felt very, very burnt out and scared? What did you do as a team to get through those tough times?
During those times, we used to encourage each other, and even we were fortunate at our facility. They found a doctor who was doing with us laughing exercises, all those distressing exercises. Like we're doing them every other day, and we would
Yeah.
laugh. They were laughing also techniques, exercises where they teach you how to laugh, when to laugh, and then also the breathing exercises. We were helped by those, and then we were also doing the Jerusalem challenge, and then we
Oh,
were
yes.
like
Mm,
and then you forget the situation around and you focus on the nicer things like those ones.
yeah. And then, Sister Mkhondo, you know, being a nurse it's so difficult. There's a question here from Koketso Mahadima. And being a nurse is 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 so difficult because it's a job that takes so much of you. It requires so much of you, and sometimes we serve a society that is very unappreciative of nurses. So when you're feeling emotionally weighed down and you're tired and you're really like nursing has taken its toll on you, what coping strategies do you use to help you to persist with your kindness, to never lose your kindness? What do you do?
Nursing for me, when I leave the clinic, I close, like I close my mind, and then when I
Mm,
arrive home, I would do whatever I need at home, like listening to music, and then
mm,
sometimes I would pray or visit friends, and then
mm,
like when I'm outside the clinic, I make sure I don't talk about the patients because that's taking the stress from my work and bringing
mm,
it home. I try
mm,
to distress without even involving the patients, like focusing on myself, like
mm,
pampering myself. I will do myself the nails and what have you, so that I
mm,
relax by
mm,
myself without taking all the work home.
mm. So what I'm hearing from you, Sister Mkondo, is that we must find ways to fill our cups because
Mm.
every time we are pouring and pouring into other people. So we must find activities that fill our cups up so that we are not constantly leaking. That's what I'm hearing from you. Am I correct?
We need to do
Okay.
that for ourselves.
Yes. And then if if you were health minister for a day, what would you change?
If I was health minister for the day, I would improve the
Yes.
working conditions of the nurses.
Yeah.
So the environment in which they work is safe, and
Mm,
then it's conducive for them to work. And also I'll advocate for them so that they can get better remuneration. Health
mm,
budget needs to be improved for them. And
yes.
then, yeah, also I'll make sure health for all is possible at all
Okay.
costs.
And then also, Sister Elizabeth, I think someone has just asked such a very important question. Are you still there, Sister Elizabeth?
Yes, I'm still here.
Oh, okay. So someone has just asked a very important question. They're asking about the trauma that COVID-19 brought. I know that some nurses buried their colleagues, and there's been such a lot of trauma with COVID-19. And some nurses themselves were sick. I know one of my friends was very sick, and she was telling me that of the trauma you feel when you're sick because you're scared you're gonna die. You're scared to go to sleep because you're scared you won't wake up. So, what advice do you have for our colleagues who've experienced this trauma with COVID-19, like how do we move forward after all this grief that nurses have experienced? How do we move forward from the loss that we've experienced even amongst our own? How do we deal with this emotional trauma?
The emotions during it was really, really bad, because in our facility, some of our colleagues got sick. But thank God, most of them came back. We never lost a colleague. So all we need to do is support each other and soldier on, because it looks like COVID is gonna stay. Hence, the numbers are rising even now. So we're still
Yes.
gonna fight this pandemic for a longer time than we anticipated. So we need each other. We need the support of each other, support of our management, so that we can able to cope amid all this stress that we will be facing.
And then one last thing, Sister Elizabeth, with COVID-19, for people who are listening, maybe who have family members who are suffering from TB, I'm thinking that with COVID-19, there's like an added anxiety about COVID-19 and TB together. So what health education can you give to our community and our listeners out there who might know of someone suffering from TB about how they can best protect themselves from COVID-19?
To protect yourself from COVID-19, you have to always wear a mask. It's a pity these days people no longer social distance or wear a mask. But in order for your safety, ensure you wear a mask, ensure you social distance, ensure you move away from people who are coughing, who are sneezing. Just make sure you protect yourself, because you can't force somebody to wear a mask or to wash your
Yes.
hands. Just protect yourself against anything that is out there, because you don't know.
Yes. And I'm sure this advice that you're giving, I'm sure you've given it, I don't know, 100 times when you were on duty, because I'm sure patients had so much anxiety about their diagnosis, and then now there's COVID. And it's so true what you're saying. We just need to adhere to the relevant protocols to all protect each other in the end. So let me just check if there's any more questions. Professor Downing, Charlene Downing says she has loved the interview. You are truly an inspiration. What a wonderful brand ambassador for our profession, Sister Elizabeth. I salute you. And I think that is, wow, such like the best way today to really round up this session. Really, we have learned so much from you, Sister Elizabeth. I know I will share this with students so that they can watch and be inspired. Really, you are such a great nurse, and we are grateful in this country to have a nurse of your caliber mentoring other young nurses and instilling the same vision and spirit and attitude in them. Really, you are amazing.
Thank you very much. Thank you so much.
Thank you so much for such an awe-inspiring conversation. I was just sitting throughout and just thinking, wow, I could literally feel your love for the profession. I could feel your dedication and your passion and just your hard work. So from Accountability Lab, we want to thank the both of you for being such phenomenal nurses. I think South Africa is richer because you are in the profession that you are. So thank you so much to the both of you. And thank you so much for taking out your time to join us and have this conversation, before us. I think all really enjoyed it. I also just want to thank also all our attendees that watched, just for joining us this evening. We're really grateful. If you haven't filled out the survey, please do fill that out. It is in the chat box. I also just want to share that we have exciting news. If you're not familiar with Integrity Icon and Accountability Lab, we host this campaign that we run every single year, where we basically seek to find and celebrate public servants like Sister Mkhondo, who are doing an amazing job, who are honest, and who serve with integrity. So this year, we have found 5 phenomenal public servants, and we are currently in the process of releasing and introducing them to the public. So there is a voting process where each and every one of them are integrity icons, but we have a People's Choice Award where you can go online, you can watch their videos, you can read up on their stories and find out who these amazing public servants are, and you can vote for your personal favorite, your People's Choice Award. And so you can do that by visiting Integrity.org. Integrity.org is the name of the website, so you can just click that and you can vote there. Also, just want to let you know that we have another Meet the Icon webinar that's taking place this time next week. So same time, same place, where we're going to be profiling another previous integrity icon of ours. So just want to say thank you again to the lovely Sister Elizabeth. Thank you again to Sanele, and most of all, thank you to everyone that attended. And please, just keep track with our events and what we're doing on social media. You can find us on Facebook, Accountability Lab South Africa, or on Twitter or Instagram at Accountability Lab SA. So that's it for tonight. I hope you all have a phenomenal evening, and thank you once again for joining us for this conversation. Have a good night, everybody.
Thank you.
You.